It's awesome to be back again with Anatomage. Yeah, as Jake said, this is one of several times I've had the opportunity to speak for Anatomage, and I really feel honored to be able to speak for Anatomage, which is such a great tool that I'm able to implement in my classroom. You know, there's some tools that we just can't quite fit in, but Anatomage has really kind of shown to be a universal tool that anybody dealing with the human body from all the aspects, Anatomage is really applicable for that. And I'm going to show some of those features there today. But first, I wanted to thank Anatomage, thank the Long Beach Unified School District and Lakewood High School for allowing me to have the Anatomage table in our classroom, for our students to be able to use it, for always being forward-driven and student first. So from there, let's get going with the presentation. I'm going to do my best to try to keep this short and in that 30-minute range, which is short for me. But man, I could speak for hours. And one thing is, we just even had a kind of a training at our school where new teachers were able to check out and use the Anatomage table. We came together on Tuesday, a couple of days ago, for all of us working together. It's pretty awesome. It's like 6 hours worth of stuff. So I'm going to try to squeeze some of that into this 30 minutes. So first, right off the bat, what we're going to be talking about is using case studies to increase student collaboration and communication. That's the main point of what I'm going to be talking about today. First, who I am. Again, my name is Aaron Volkoff. I teach Introduction to Healthcare class we call Healthcare Analysis in our district. I also teach a Fundamentals of Exercise Science. So it's really a strong exercise phys class. I'm at Lakewood High School in the Long Beach Unified School District. I'm dual credentialed in science and CTE. So understand my lens. I've been teaching for over 22 years now. I've been at Lakewood High School the entire time, and so obviously in the Long Beach Unified School District. I've written a handful of courses, and I've taught them all, like most of us out there that have been in education long enough. It's kind of a carousel of teaching. So it's been fortunate for me to have a bunch of different experiences that I could bring in to my healthcare classes right now and my exercise science classes as well. So first off, just I want to apologize in advance for any inaccuracies I have. It just is my lens. If I say something that is maybe an off-putting joke, I do apologize. It's a problem. My wife tells me so after I say that. She says, you can't say that. So maybe my levity doesn't quite hit home all the time. So I apologize in advance. If I say something that is inaccurate in the terms of whether it's even science or medical or even table application, it's just the way I see things. So for me, I'm speaking as much truth as I can. So my story a little bit, why I think the Anatomage table is so important, is that I was a science major. I got a degree in exercise science or exercise physiology from UC Davis. And then while I was doing that, I became an EMT. So my senior year, I was going to night school, taking that EMT program. I plan on going to become a physician's assistant. And one thing I realized when I was going through both the programs as an EMT, we kind of learn as an exercise scientist or a physiologist how the body works, and maybe when it's adapting a little bit, but not really when it's broken. And as an EMT, especially as an EMT, really didn't learn much at all about how the systems are broken. We just kind of really learned about how to treat it, maybe how to fix it, but really didn't make the connection. And I think there's a big disconnect in between the science applications and the healthcare applications. And I think there's more than a disconnect, there's a huge opportunity to develop this problem solving and the critical thinking that we could develop in our students. So when they start seeing a system that's acting, when a system breaks, what parts of that system and how to fix it. So it's more than just the human body. I think this becomes universal into the problem solving and critical thinking. So the point, again, is just what I just mentioned, is to make that connection in between a system, how it works, a broken system, what's broken in it, and what do we need to fix to bring that system back into normal. So to give you a background of where my students are at, I hear this in different topics where people are like, I can't do that. You don't have my kids. You don't understand. Well, let me tell you where I come from. So right now I'm teaching juniors, 11th grade. And have they had A&P, a nat phys? Maybe, not necessarily. And this year I looked, the GPA my lowest is a 0.5 and my highest is a 4.0. So I teach what's required, what is titled a required elective. So I know the irony in that one is, but it's the students, it's required in their course sequence, but it's an elective in the terms of the course catalog. So I have a broad range sitting in the same seats, and I have to try to teach them all. So I have to develop a system where I'm teaching the 0.5s and the 4.0s. So they're all progressing. Nobody's either left behind or nobody's slowed down. So for years, I've been using what's called the 5E learning cycle. The 5E learning cycle, I've talked about this before on some of my presentations. It's not developed by me. It's been around for forever. I'm going to go through each of those steps as we talk. So the steps are engage, explore, explain, elaborate, and evaluate. So the original plan I was using with the 5E cycle went something like this. So this is a plan I've been using for with the Anatomage Table for about 3 years. Oh, no, we could probably say 4 or 5 years. It's kind of weird. COVID screws everything up. I did use it. I was able to use it last year, but not the previous year when we were at home the entire year. So first is the engage. The engage is just a grabbing attention grabber. So we grab their attention really, really quick. It's a short video or maybe a hands-on experiment, show them something that's going to grab their attention, even a case library, images that I'll show you here in a bit, start to get them thinking about where we're going. So this is Troy James, I believe his name is. He's off of American Idol. He does some crazy things. We're talking about range of motion, leads the discussion about double jointedness or the myth or the misnomer of double jointedness. They watch another one where they do this thing called the Baton score or a Baton test, and they develop a score to find out if they're hypermobile. And then they go on to start exploring. So for that previous one, that was range of motion. Here's an example of where I'm using the Anatomage Table to incorporate exploration of the cardiovascular system. So I use it as a review in the sense of where mine are juniors, so they should have had anatomy and physiology, but I still need to go back and review it. They definitely don't know the information well enough by the time they get to me. They've forgotten a lot of it. So it's kind of a reteaching moment where I use the Anatomage Table to cover over the aspects of the system, the anatomy of the system. There's 2 ways we do the exploration. The students could go back to the Anatomage Table and follow the written instructions. And then during COVID, I had to take a break from that. Here's an example of, this is going back to the prime movers. I'm kind of bouncing back and forth to show you different ways it's incorporated where the students are actually using the prime mover. So this is a short little video we could watch where you see the students going through and trying to investigate. So they all have clipboards and they're trying to identify different muscles. The other way would be teacher guided, to where I created lectures. This is what I did during COVID. I would create the lectures and the students would watch the lectures, and this is more teacher guided. So the exploration doesn't have to be using the Anatomage Table in terms of hands-on. You can use it also as a lecture tool. Rarely do I do that. Really only during COVID do I ever really use it directly as a lecture tool. Explanation. So we've went through engage, we've went through explore, and now we go through explain. So this is where we're making the connections to the phenomenon. I'm going to give you an example of a phenomenon in a minute, or phenomenon is singular. So I'm going to make a connection to that. So this is where they start to make the connections. This is where the Anatomage Table, again, we're exploring the cardiovascular system and the structures of it. Maybe it's a review, but we're still going over the structures of the cardiovascular system, what those structures do. And this is where we're taking when it's broken, and the students are going to start to identify different cases from the case library. As you can see right now, on the screen, you could see this would be a comparison library from Anatomage. This is a screenshot from Anatomage. This would be, we're looking at probably a fem-fem bypass or some form of stenosis going on here. You could see on the right-hand side as we look at it, the right-hand side, a nice, supple, beautiful descending aorta. And as we go over towards the middle, it's a giant mess, which we got a stent down here. We don't even have an iliac artery over here on this side. And over here, we got whatever this is, a giant mess. If we look hard enough, we'll find an aneurysm in here where you can see the size of this aorta, the descending aorta compared to the other one. So this is where the students start making connections. We start asking questions like, what happens to blood flow when somebody's has an aorta like the two that are diseased compared to the normal one? So what's going to happen to blood flow to the lower limbs? What are the causes of this? What could cause something like this? So this is where we start to make that connection. We know what the normal system looks like. Now we know what a broken system looks like. What's causing it and how do we treat it? That's where we try to reach. This would be from the exercise science or the range of motion, where the students start to talk about how different exercises incorporate different muscles, how a movement, where a vertical pull would incorporate the lats differently than like a horizontal pull. So we're taking something that's just strength training, and we're still really trying to make those connections to understand muscle fiber directions and orientation. And this brings into a lot of biomechanics. So I get to have a little fun with biomechanics in this section. Those of you that are kinesiologists, this works really well with kinesiology as well. So here's another explanation. This is the explanation 2. So I'm going to play this video just for a second. The audio is horrible on it. Try to fix it. Totally can't. Where these students are actually going through this case here, making a diagnosis of what's going on in this situation. I'm going to talk about this a little bit more. So this would be a knee replacement and an amputation here. And if you were to, I'm going to pause it at this point so I could speak over them. If you were to listen, these students actually start to discuss what's going on with the patient and what are possible causes. I'll talk about this hopefully on the next slide. So I'll get to that slide. I'm going to come back to that slide we just talked about here in a second, but I want to go through the 5E cycle. So we've had to engage, get them excited, explore, look at something, explain what's going on. The next one, you could do a second explore, explain, and then you could have multiple explore, explain. So when actually I do vitals, I'll do an explore, explain, I'll do an engage of vitals, showing somebody having a heart attack, showing somebody in respiratory distress, get them to start thinking about what vitals those are related to, what organs might be struggling, how to treat it, and then we go on to explore, explain for T, temperature, P, pulse, R, respiration. I include SpO2 nowadays, and BP as well. So we'll do explore, explain for that. Yeah, we could do pain if you'd like to. I don't do an explore, explain for pain though. So this would be an example of an elaboration where the students actually create a strength training program for an off season for a sport they choose specifically. And then the evaluation could be any form of testing you want. This could be a differential diagnosis. This could be a case study, a SOAP note, and a good old-fashioned written test. Now, that was my old plan, and I'm going to get more and more into the case library, but I just want to talk about the way my old plan worked. And I'm still using my old plan. It hasn't gone away. But this is a bit of my new plan. I've just started this year. Now, I think it's a home run. Now, you might have been doing this for years and you're like, dude, totally, it's duh. But for me, it's brand new. I haven't seen anybody else do this, and I'm really, really excited about it. I have these students really engaged over a long period of time in the terms of something we started first couple weeks of school, we're still working on now, and I'll talk about it as I go through this. So old plan was 1 or 2 days. We took from the case library, we had a standardized patient and a diagnosis. That's how we do the case study. Then they would report on a second day or create a SOAP note or a poster. The new is intro. Right now, it's going to be 1 or 2 months, and it's going to be a 3-step process. It's an intro to the systems. It's possible disease and conditions. And then step 3 is assess and treat. And I'm going to talk about that. Again, both are sticking around. I'm actually embedding how I'm using the original case studies with the new case studies. So again, it's a 3-step process I'm working on right now for this first plan, or for the new plan. I'm doing intro to healthcare, vitals, and shock. This new system, compared to the old system where it's just 1 or 2 days, it really is increasing our ability for linked learning. I'm really trying to make these connections with bringing in my healthcare class into all of the academic sequences. So the short term, we've always run into the problem where we want to do I'm doing my healthcare section on October 27th and 28th. Well, the English teacher can't line up with that because they only have a free time in November 14th. This longer plan is giving all of the different curricula opportunities, or all the different classes opportunities to work on their section in their class when it fits them over that 2 or 3 month period of time. So whether it's general anatomy, whether it's healthcare skills, whether it's technical readings, patient reports, lab chemistry for our medical chemistry class, math as well could be involved in here when we're starting to talk about vitals, like whether we're just doing simple things like MAP or getting more complicated with it, conversions as well. So if you have medical math, it's a great opportunity to incorporate into your math class. So I'll talk more about that. So here we go. You're going to join me. This is what my students are doing right now. You're going to join me along. Let's take a ride. So intro to the simulated patient. So right off the bat, the storyline, going back to the 5E. So for the 5E, you want to create a storyline before we start writing the engagement. The storyline is really, where are we going on this path? So in this case, this is what I'm using this year. A well-functioning human body works in balance and a narrow window. This balance is called homeostasis. Slight changes in a person's internal environment can have a large effect on how the system functions. So that's the storyline for me. I don't share it with the students, but that's for me so I know that I'm following along this path. So now, the students do know this one. How do we get Stan back to normal? So that's my question. Here's Stan. How do we get him back to normal? Some guided questions for me are things like, how do the body systems interact? What organs control and affect vitals? How are vitals used to aid in diagnosis? How are vitals related to shock? What are the types of shock? What are the causes of shock? How do we treat shock? So in this case, these students know these questions. These are the questions that we often have on the board. We throw them up on Canvas so the students kind of know where we're going and what to think. So ready to step into the shoes of a student? Here we go, going back to Stan. Stage 1 is a patient exchange report. So you can see here, these are my patients, or my students in the lower left-hand corner. They only get a verbal report. But I tell them before I start, you could ask any questions you want, and I'll give you the answers, but I'm only going to give it to you verbally. I'm not going to give you a written copy of this report because I believe verbal communication is the primary way us humans communicate. So it's important they understand how to communicate. Upper left-hand corner, you'll see Stan. That is our patient. If you don't have a high-fidelity mannequin, it doesn't matter at all. You don't even need a really mannequin on this one. You could just pretend like the person exists. Lower right, or if you have any form of a mannequin, like even a CPR mannequin or anything like a doll, that would work as well. You don't need that. Lower right-hand corner, you could actually see our students going over types of communication. So we went over forms of communication. So the students listen, ask questions, write down the information. And this is where I really, really guide them to start asking good questions because, man, if one person would just say, hey, can you read the report over again? I totally would. They asked some questions, but they really trying to get them to really start asking questions to fill in the blanks that they have. So the report was a 38-year-old male named Stan D. Armand was working Sunday, September 4th as a roofer at a home near Lakewood Mall. His day started around 600 and ended around 1700. At the end of his shift, he complained of dizziness and a severe headache. The paramedics observed confusion, altered mental status, slurred speech. His skin was hot, dry, and red to touch. So this is September 4th. That was a Sunday in the Lakewood region. So this is all near our home. And it was like 107 that day. So you'd imagine that'd be a brutal day to be on a roofer. A little bit more information. His coworkers reported that they took a 30-minute lunch around noon, but otherwise worked straight through. They also reported that the patient was working on the roof all day and had taken no breaks. After lunch, he became more and more angry. Two of the coworkers stated they left him last night at the Thirsty Owl Sports Bar at midnight, where they were all drinking heavily. So what we do know, they had that information along the way. Let's see if you guys are trying to figure out what's going on with Stan. They then get his vitals. Again, this is all verbal. Nothing is written for him. So they're given his vitals, where they have his height and weight, in centimeters and kilograms. They have to convert that, so because they don't know what that is. So they have to figure out what that means. Heart rate, blood pressure, respiratory rate, temperature, SpO2. You can see all the numbers that are on the board. Now, my students don't know anything about this. So realize it's not like they know what normal is. They may or may not know what that 166 is, a scorching high heart rate for rest, like crazy high. And the blood pressure is like deadly low, but they probably don't know that. Doesn't matter yet, because again, this is a long process. We're just starting to get them to think. We're going to carry this throughout the next 2 to 3, or it's going to be about 2.5 months, to be honest. So they complete an exchange report. You saw them writing. I gave them this template, not filled in, and then they went and filled it in. So I don't just give them a blank piece of paper. I give them guidance along the way on what they need to write. So here we go. That's step one. Part of step one is what we do is a systems overview. So again, this is a review, or for some of my students, it's the first time that they start to realize the heart is part of the cardiovascular system. So they will use the Anatomage and go over the systems overview activity. So they go over the systems overview activity and other connections to the body system. So we do the Anatomage systems overview. While they're doing that, they're doing things like working on a worksheet to start making the connection. So they go through, now they'll write down on a different sheet, they have Stan's vitals. Now they'll figure out if they're normal or abnormal and why are they possibly broken. After that, so that's the intro unit. Then we go on to the next unit, which is going to be vitals. So Anatomage has a worksheet for vitals where they create these vitals worksheet. They're going to complete the vitals worksheet. And then we go on to stage two. Stage two is going to be lab results. I give them labs. They look over these labs. On that one, they try to figure out what's going on, what's broken, doing another worksheet. And then this is where we really, so right now we've gone through Anatomage to show the intro to the body systems, Anatomage to show vitals, and now we get into the meat and the potatoes, the really heavy hitting, the really critical thinking of this case study. So at first, it's really starting to think, okay, blood pressure is really, really low. Why? What's possibly affecting it? What systems are possibly affecting it? Is it the brain? Is it the heart? Is it the kidneys? Yeah, all thumbs up. Is it the skeletal system? Probably not. So they start to make these connections. Then on stage three, we start to go over shock. And this is really where the Anatomage table comes in, I don't know if I could, it would be a really hard challenge to complete this without the Anatomage table. And that's the diagnosis and treatment. So this is where I talked about where I'm doing the long-term and the short-term case studies. This is where I bring in a short-term case study. So the first thing they do is they do the Anatomage types of shock activity. And I'm not going to spend time going over this. This is it. They then, after they do that, they'll do some other work along the way. They're going to use the case library. Now, we don't have time today to go over how the case library works, but it's going to slide up really, really quick. I just want to show you, this is just showing up how many different cases there are in the case library. So there is a ton of them, and there's more and more being added. So I'm not sure Jay could attest whether or not Table 9 has more cases in it. So the case in the library navigation, as you could go through on this one here, we'll just go through really, really quick. You go to the home button, you open up your Anatomage. As you go through that, you navigate, you get to the case library, and then we have all of these different specialties where I like to go. And with the specialty, I'm actually changing the way I teach the course to align with the Anatomage titles because I believe they align with healthcare more so. I used to teach muscular and skeletal kind of separately, but now I'm teaching it as orthopedics, combine the two together. So instead of urogenital, I'm now calling it urology to match what is in the specialty. So we're going to go through, we're just going to save some time right now. This is just how to navigate through the case library, and it's going to show you some of the cases, but I'm going to do that separately. So if you could reach out to Anatomage if you want some instruction on how to navigate through the case library, but today's much more about how I'm going to use it. So we start to talk about the types of shocks. First, we go over the classifications, and then I like to get a little bit more specific. So for some of you on the left-hand side that say that the metabolic acidosis and respiratory acidosis aren't a type of shock, they're more type of distributive shock or something of that nature, I totally get it. But again, for me to make the connections with the students, I want them to understand what systems are involved, how they're broken, how do we fix them? So this works better for me if I go over 8 different types of shock. On the right-hand side, you can see the cases that I'm going to use in my short-term case study. So this is what's going on right now. We still have Stan, and every couple times a week, students are asking me, hey, what's wrong with Stan? I'm like, it's only been 30 minutes. Like, it's been 30 minutes. I'm like, yeah, we paused time for a little bit. We'll get back to him. So you already know what happened with him. You know what his vitals, you know his lab results. Now we got to figure out how we're going to treat him. That's next. That's going to be the end of the case. But before that, they have to learn the types of shock. So they go through and they're going to investigate these different types of shock. So here's an example of a knee replacement. Now, one thing I haven't mentioned, if you don't know this, on the left-hand side, I did not, I could not write the case report. So on the left-hand side, you'll see a case report. These are actually all the case reports written by the radiologist that have been submitted to Anatomage along with the scans. So these scans are living people, or were living people at least at one point, and all of these scans are provided to Anatomage, and then Anatomage has loaded them up into the table. So that's the report. And again, when you go to the case library, some of them might not have a report. Well, that's just because Anatomage isn't going to write the report. There wasn't a report provided when they received the scan. So one thing my students do, one way I have them is do the SOAP note, subjective, objective assessment and plan. So this is where, again, critical thinking. Well, they don't know the subjective for the most part. Some of the cases do have some subjective information, but they have to figure out, okay, a dude with a double knee replacement and amputation, what are some of the signs and symptoms he's going to have? What are some of the causes? So that previous video where there was gals working around the table, and I was going to get back to it, this is where they actually started talking about, and I didn't think about it. I would have gone with maybe septic shock, but they kind of went, he has an amputation, maybe he's a diabetic, so they started going to metabolic acidosis. I'm like, whoa, yeah, that's probably a better answer, because this looked pretty much all done and healed up. If we kind of go back and play it from the beginning, it's pretty healed. So possibly not septic shock in that case. So metabolic, yeah, they went with it. It was a pretty cool investigation for what those students did. So again, this is the short term going back. This is where I was going to say, students look at the Anatomage table, they have the patient report, and they know it's going to be one of those 8 types of shock. So I don't just say, it could be anything. You got to narrow it down. So I'm going to give them one of the 8 types of shock, and they're going to have to try to figure out which type it is. So they look at the Anatomage table. They go back and meet a mannequin. Again, it doesn't have to be a mannequin. And when I do this short term, which I've done several times, a lot of times I'll use real humans. So like orthopedics, if we're doing nerve stuff or we're doing broken stuff, I have them act it out. And the students enjoy doing that. Some are awesome, some are not. But at the end of the day, it gives them more time to be interactive and more time to work on stuff. And then they do a patient assessment. So the assessment is going to be diagnosis, treatment, and a treatment plan for whatever's wrong with this patient. So they first would have to verify with me what the type is. Actually, let me remind me on this one. I actually don't. If they treat him wrong, he dies because it's shock. So I don't give them any chance to make a second treatment. They make the first treatment's wrong, the patient dies. So sadly enough, sometimes that's life. So we got a case study interpretation here, and this is where those gals are working that we talked about. Audio's not so good, and this is them trying to make that assessment. I'm going to speed through this video, save you some time. Where we've got the case study posters here. This is one example I have the students do. Same idea with that shock. If I give them spina bifida, So I'll have them, I'll give them from the case library, I'll give them different conditions. They'll go back and they'll look, and you could actually see on here, if you look at those images, those are screenshots, or some of them are screenshots from the Anatomage table. So the students, I provide them thumb drives. So I have 3 rotating around. The students will go to the thumb drive, take a screenshot, load it up onto their Chromebooks, give me the thumb drive back, and we just have this rotation where students get screenshots from the Anatomage table, and they use the case report to create case study posters. And as your brains are turning, I hope they're turning, and oh, maybe this is how I could kind of use the case library. I'm going to go in this direction. Please do, and then share it with the rest of us, because there's so many great ideas on there on how to incorporate the Anatomage table into your specific curriculum. So as we go through, now we get to the Stan D. Arman diagnosis. So this is where the students are going to work with Stan to try to figure out what is wrong with him. And hopefully you thought about it. If we would have gone through the vitals, you already had the patient report. If I would have showed you the lab results, maybe you would have figured out dude was super dehydrated. He was dying of hypovolemic shock. So hopefully I'll find out right before Thanksgiving whether or not they go ahead and pump him full of fluids. Give him some fluids and some other stuff, and then he'll be all right. I had a nurse that was talking to me about it yesterday, and she had some great suggestions that I'll be going with. I'm not going to throw them out because I don't want to be wrong. So I have to go back and look at my notes on treatment plans for hypovolemic shock, because he's not bleeding. He's just dehydrated. So here are some sample cases to give you an idea of what I'm going to be using. I've went through and I've located a ton of different cases that I'm able to incorporate into my class. So this example, this is the first case I've ever looked at. We actually looked this on our initial install of the Anatomage table. This would be an 85-year-old male with a fem-fem bypass. You could see through here where he's got this tube running across from his left femoral artery to his right femoral artery, hence the name fem-fem bypass. There's a portion of the case report that's up there. You could see here when I do neurology, it's going to be a traumatic brain injury. You could see those with screenshot from the Anatomage table, part of his brain sticking out through a skull. And as you read right here, the brain bulges out through the area removed with bone. So the students will go back, take screenshots, go possibly analyze, figure out what's going on. Like for neurology, there's also one with the gunshot. There's a few. So each of these are just examples, not the only one I use. So like for pulmonology, in this case, this person has a diseased lung. So I'll try to figure out what's going on with them. So I wouldn't give them diseased lung by title. I would end up giving them something of the nature of, emphysema. And they'd try to diagnose using this information, whether or not the person had emphysema, compared to, let's say, like asthma or COVID or something like that. So they look at different images to try to make that diagnosis. So this is orthopedics. You could see somebody with a hip fracture at this point. So if I give somebody with if I give them this and I say somebody has a hip fracture, here's your list. Then I give them the cases. It might be a hip fracture, might be a broken ankle, a broken elbow. And they're going to go back and look at this slide. I think sometimes we give our students too much credit, or give humans too much credit, to be honest, not just our students, that they'll be able to make the diagnosis by looking at this. You'd be shocked on how many times, if you let them look at this on the Anatomage table and then go back and look, they won't be able to figure it out. So for the whole point, again, is I give them these case reports, they read through the case reports and then try to diagnose by using the Anatomage table. And just to get them to critically think like, hey, we got to identify the pelvis. It's the pelvis. This person has an iliac fracture. This is at the point the students have to know what iliac means. So they're front loaded with this information, with this report, and then they go back and look at the Anatomage to try to diagnose. Urology, horseshoe kidneys. Had no idea those existed, but they do. And I love this one to show you guys, because if you look down here, it actually has labs on there. So it provides a bunch of information, including labs. So whoever wrote this report included a lot of information that is really helpful for our students. So they're able to go back and look again. But remember, I front loaded what normal is. So I just didn't send them back because my students would have no idea. And in fact, not my students. You take most humans, you throw them this, and they wouldn't realize that kidneys don't look like that because they don't know. So I front load my students with normal looking looks like, and then this horseshoe kidney from here. Gastrointestinal, somebody with a bowel obstruction. And then just some physiology examples where it helps me make that connection. If you go through here, like EKGs on there, so this is when I'm doing cardiovascular, we start to try to identify different spots, different chambers of the heart. And this goes really, really well using my short-term case library. So I use the Anatomage. They look at normal heart, they look at a beating heart, and then we go through some of the diseases of the cardiovascular system to try to make that connection. Again, from normal, in this case, it's great. It's in motion, and then abnormal. And it always is, what's broken and what do you do to fix it? Because the cardiovascular system, fem bypass is going to be way different than somebody with cardiomyopathy. Both systems, but they got to figure out how one's peripheral, one's cardiovascular, and how do you treat it? Nerve pathways, man, this one's awesome. Our sports medicine instructor was all over this. They love it because, concussions and, more so using this is more so in paralysis. If you touch a muscle, it'll let you know what nerve is innervated by it. So you could go through and realize if somebody's paralyzed or has pain in there, if somebody has a herniated disc, how it's going to be affected. So when I'm doing, this is where I connect the neuromuscular system together. The students will actually use this one. So they'll look at a case library, case from the case library. They actually go and treat a patient that has some form of an orthopedic issue or a neuromuscular issue. Like things like spina bifida is another great example, a handful of spina bifida in there that you could use in terms of neuromuscular. So how the nervous system is affecting the muscular system. Kinesiology is on there as well, where students are able to, and this is going to be updated. Jake, you could speak on table 9, whether or not the new kinesiology is ready to go, but the rumors are, hopefully it is, but the rumors are kinesiology is supposed to be updated. So from exercise science students, this is great for range of motion, but also just for any forms of orthopedics, I'm going to incorporate this as well. All right, so end of the day, I should have a summary on here. So let me summarize. I'm using the case library in 2 different ways. One is a short term, where the students will get a case, like when we talk about shock, they're going to be given a one type of shock. They're going to be given the report. They're going to go back and look at the Anatomage table. They're going to look at the image. They're going to look at the report. They're then going to go meet the patient. And sometimes the patient is unresponsive, and it's actually me acting on behalf, where they're going to ask any questions that they want. Sometimes I act as the bedside nurse, and I'll provide an exchange report for them. Then they create a plan for treatment. And in shock, if their plan for treatment is wrong, the person dies. And every case is a little bit different depending on every scenario is different depending on it. But shock, they do die because you have to respond so quickly. Long term is where you're going to do something that's going to cover many different cases and activities from the Anatomage table. That's going to take a longer period of time. So again, right now I'm working on this. The first time I've done it, I'm working on pretty much a 2.5-month case study. Why I can't give you the exact time because I'm not done with it yet, but a 2.5 case study where I'm just introducing little bits along the way, and I'm using the Anatomage to make connections to how those systems are working. The next unit I'll be going on to with that case that I'll be using this long-term will be cardiorespiratory. Actually, I'm going to do cardiovascular and respiratory together, and they're going to have to figure out what's going on. So I'm still working on that one. I'm excited for that. And then the last will actually be orthopedics, and I haven't decided if I'm going to go neuromuscular or if I'm just going to go straight bones and muscles on that one. And then I'll do a digestive. So that'll finish up kind of those big pictures. I might do digestive and urogenital, big picture, and they're going to have to figure out along the way. It's all the insides, which part of the insides are broken. So thanks again for letting me hang out with you. Thanks again for Anatomage for letting me be here, and here to stick around if you guys have any questions.